proactive. And I like to say this is not a Republican issue or a Democratic issue, because you can approach it from any angle you wish. And it comes down that it is better for the patient, it is better for their family, and it is better for society. And unfortunately, we see example after example of the negative effects of ignoring it upon society. And if I just gave you a litany without details, you would know what I meant. If I said Sandy Hook, Virginia Tech, Aurora, Colorado, and Pittsburgh. And we say this not as an excuse for terrible events, but as a method to understand. Because if we do not understand, then we will never be able to address. And if we do not address, that litany goes longer and longer. Now, we in Washington, D.C., so to speak, if just for a moment I can be in Congress as your senator, will create resources for states and communities to do good things. But it ultimately comes down to states and communities providing leadership. And this panel, these speakers we have, are examples both of the federal resources that have been made available, but also of communities that have implemented using local, state, and federal resources to proactively address these issues. Now, that is our hope. And again, I was so pleased that two of our panelists are originally from Louisiana. Displeased that they left, but pleased that they are here, if you will, testimony that our folks can implement these programs. I mentioned public officials earlier. Pat Brister's over there. North Shore St. Tammany has done a great job of integrating these sorts of community solutions that benefit all. Marilyn Castle, the judge who will be here, is from Lafayette. Judge Garcia from St. Tammany. Again, I mentioned Judge Johnson. All these folks are here in Louisiana putting in good programs that benefit the patient, the family, and the community. Now, I'm now going to speak a little bit to Pete Early. He's going to be our speaker. I'm not sure any of this would have happened without Pete Early. Pete Early, because if you know, when you speak of mental illness, people don't speak of mental illness. And you know of somebody whose family member is mentally ill, they will never tell you that. It is the craziest thing in the world. Excuse my kind of pun. But Pete Early did. His son had a psychotic break, began to interact with the criminal justice system, and not only did he speak of it, but he wrote of it. And as he wrote, he began to reveal just how terrible the situation is. And I won't steal his thunder, but just if you treat it right, you save lots of money for society, but you also save a life and the dynamics of a family. I got started in this because I was reading his book, and a Democratic senator from, then a congressman, both in Congress, from Connecticut, Chris Murphy, he had an interest in this, and he saw I was carrying the book Crazy. He had read it, he understood what it was about, and then we began a collaboration that led to passage of the Mental Health Bill of 2016. We were both freshman senators, and people said, oh, you're not going to pass this. It's a major piece of legislation. Biggest reform of healthcare of mental health for 30 years. You're two freshmen. They didn't know what we know. I called up all the psychologists, psychiatrists, and NAMI, and everybody else in Louisiana, and I said, call your friends in Tennessee and tell them to call Senator Alexander and work them over. And y'all worked them over. And we ended up passing that in the 21st Century Cures Bill. And some of the things that bill has is, let me just see if I can get it on my list, use of assisted outpatient treatment, identifying and encouraging the use of evidence-based treatment to improve quality of care, integrated models for care merging primary care with behavioral health available to children and adults, allowing provisions for those from age 0, just born, through childhood, which was directly inspired by our post-Katrina experience, where the Osofskys in New Orleans noticed separation problems and attachment problems between mothers and their babies after Katrina from the time of birth. That was Louisiana's imprint upon national policy. same-day billing for primary care and mental health services, and then the Interdepartmental Serious Mental Illness Coordinating Committee, of which Pete Early is a member, to study these issues and offer a strategic plan for federal and state efforts. Now, let's talk a little bit about strategy, and I'll return to where I started. That's a federal strategy, but it's not going to work unless there is a state, parish, and local strategy, and that will be led by you. It will not happen from Washington, D.C. or from Department of Health or the governor's office. They'll be a part of it, but it's ultimately going to be our parish and our local communities that provide that leadership, and that's what this is about. Your leadership starts in this conference. These speakers, I've told them all to expect pointed, strong, challenging questions. Iron sharpeneth iron. And so if all you do is be polite, as we sometimes are, and not ask them that question, ask them the question, because then they will give you the answer, and then you will be that much better prepared to provide that local leadership. Our next strategy is for us, we in Louisiana, to figure out how to implement. I thank you very much for being part of that strategy, and I very much look forward to your leadership. And now I'm going to ask Pete Early to come up.